BBC Radio Scotland and Sounds.
OK, researchers in Edinburgh are looking for new ways to tackle aggressive ovarian cancer. In particular, they're looking at how it resists some treatments. Let's speak now to Dr. Rob Hollis, who's the lead researcher on the project and is from the Institute of Genetics and Cancer at Edinburgh University. Good afternoon, Rob.
Hi, thanks very much for having me.
Well, thanks for coming on. Just give us a picture at the moment then about ovarian cancer in Scotland, what cases are like and how aggressive the disease can be.
Yeah, so ovarian cancer is about the sixth most common cancer in women in the UK. That's about 7,500 new cases per year in the UK, and we see about 500 to 600 of those here in Scotland.
And what are the sort of outcomes at the moment then for women who get treated for ovarian cancer?
So unfortunately, most women with ovarian cancer are diagnosed when the cancer is spread beyond the ovary. And for those individuals, the 5-year survival is only about 30 to 40%.
Right, okay. So what kind of treatments are available at the moment then?
So for a long time, ovarian cancer treatment hadn't really changed much at all. So it was mainly chemotherapies, traditional chemotherapies. And about 10 years ago, we did get access to a new class of drug called PARP inhibitors, which we know do improve ovarian cancer survival, but they're most effective in only a subset of individuals. And unfortunately, treatment resistance is still a huge problem.
Right. So tell us a bit about this new project then that you've embarked on.
Yeah, so most ovarian cancers respond very well to initial treatment, but the problem is that cancer often comes back. If it does come back, which we call recurrence, it often develops resistance to the treatments that we have. And this study is all about finding the molecular switches that trigger the development of this resistance to treatment in cancer cells.
Right. So how long do you think it will be before you perhaps get some answers in terms of better treatments?
So this project is 6 years long, and within the last couple of years of that project, we should get a really good idea of new cancer drugs that might be effective when other drugs have become ineffective. And these really will represent potentially the next generation of drugs that would go into clinical trials.
Right. And also, would it help to be able to diagnose ovarian cancer at a bit of an earlier stage as well?
Yeah, so unfortunately, most people are diagnosed at what we would call late stage. And that's because often in the early stages of ovarian cancer, people don't really get noticeable symptoms. And when they do, the symptoms tend to be quite non-specific. So things like persistent bloating, feeling full quickly when eating, or needing to urinate more frequently. And there are lots of other explanations for these symptoms. So honing in on the possibility of ovarian cancer is quite a challenge.
So what is the process like then of your study finishes and then you manage to find some new treatments and some new drugs? What then is the process for perhaps getting them made? And then, of course, there's the whole issue of seeing if they can be approved for use on the NHS.
Yeah, absolutely. So one of the most exciting things about this project is that a lot of the drugs we'll be investigating are actually already used either for other cancer types or for other diseases. And so we already know things like dosing profiles, we know what the potential side effects are. And so these are drugs that can actually be fast-tracked towards patients much more quickly than completely new compounds.
OK, well, thank you very much for talking to us on the programme and all the best with your research going forward. Dr. Rob Hollis there, who is from Edinburgh University. Now, two of Scotland's busiest